The robotic surgery program that we have to offer here at Lurie Children's allows us to push the limits of minimally invasive surgery for children.
We have been really pleased with kids' outcomes after robotic surgeries here at Lurie Children's. In fact, we think that many kids after their complex operations are going home even faster than they would have with traditional approaches.
The motions of the robot are actually quite natural. They're similar to what your hands might be doing in the body, except my hands are much bigger than these tiny instruments, which, the tips are less than a centimeter in length.
The robot doesn't make any independent movements or decisions or anything like that. The robot only does exactly what we tell it to do. My movement becomes the movement of the robot.
We often think that using the robot is even safer than our traditional minimally invasive equipment because of our dexterity with the instruments.
Outcome advantage of the robot really relates to the precision of everything we're able to do with it. So with standard laparoscopy, we're looking at a two-dimensional image. However, the robot actually has three-dimensional image capabilities. And so that depth perception gives me really added precision that helps with the visualization. Another big advantage of the robot is with its ability to work in very tight spaces. The robot has a wrist, so when I'm working, I can control not just this, but I can control how the wrist moves so that I can get into tight spaces and work at all sorts of different angles in a very precise way.
We see the robot as a tool that we can use for almost any minimally invasive operation that we would offer a child, whether that's thoracoscopy in the chest or laparoscopy in the abdomen.
The incisions are much smaller, the scars are much less visible in the long run. Certainly for older children, there's an advantage in terms of pain and discomfort after surgery, quicker recoveries.
There are very few places in the country where a child can come with a surgical disease and undergo a truly minimally invasive operation with the robot. We think that the program we've built at Lurie Children's is among the best in the country at putting the right expert in front of the right child at the right time.